The Medical Dental Summit is being driven by Tri-Cities dentist Lee Osler and Carol Moser, head of the Benton Franklin Community Health Alliance. During a recent interview on Cadlic's weekly radio program, they talked about the growing evidence that poor oral health can lead to cardiovascular disease, diabetes, cancer, and other health problems.
We see the emerging data coming out largely from the medical literature showing us that oral infections and oral health is a big player in the whole body inflammatory burden. Therefore, we have to put it into the same environment, and it's just unfortunate that we don't have a system different in the United States today where dentistry is actually a specialty inside medicine. Whether that's a good thing or a bad thing, I don't know yet, but it's the same body. You can't partition the body out into body parts and just say, well, so it's a training issue. Physicians are largely just unaware. They think that dentists will take care of that, and dentists just assume that the physicians obviously are going to take care of the body. And now the linkages have to happen and the training has to occur to make it come together.
So on April 25th, members of the healthcare community are invited to learn about this link. Experts from a wide array of medical specialties will present their perspectives. It's all designed to help us all improve our health, which can also help control healthcare costs.
When you drill down to that and look at the health needs assessment that we did a couple of years ago, affordability of healthcare was one of the top concerns across all income levels. And so the Alliance truly believes that by helping coordinate the care and bringing these providers together, we can reduce our costs locally.
Suddenly, healthcare insurance companies, hospitals, health plans and so forth, they're all recognizing that it's in their best interest to motivate and encourage their insured people, policyholders, to have clean mouths. So they're encouraging and doing that. And so collaboratively in the community, then there's this educational process that has to go on where we've got to help the physicians, at least to get down at the grassroots level, understand that they can maintain better health results in their own patients if they encourage that collaboration. And it's reciprocal in both directions. And so physicians and dentists are now talking more frankly and openly to their patients. If you've got blood in the sink after you brush your teeth, that's not a good sign. That means that you've got inflammation. That's a harbinger of disease. And so something needs to be done, something needs to be said about it. Directly related to costs, and I think that's going to be a driving factor going forward. I'd like to think everybody's really altruistic about good health and lifestyle, but costs matter.
Dr. Osler is a practicing dentist in Richland. He is also chair of the American Academy for Oral Systemic Health.